PrEP means pre-exposure prophylaxis, which generally means an initiative, or rather a mechanism of preventing or protecting those who are HIV negative from getting infected by the use of these PrEP drugs. So PrEP is a drug that is used by a person or people who are HIV negative and have been confirmed negative, and those who are at higher risk of getting HIV transmission from their sexual partners. It may mean somebody having multiple sexual partners, or even just an individual sexual partner whose status is not known, and the person in question queries the risk of getting infected.
Hiyo PrEP venye mtu anaimeza hivyo, sasa inamaanisha ataimeza for hizo la lifetime ama?
PrEP is taken as long as the person is still at risk of contracting the virus. We recommend that the use of PrEP continues until that time when we have eliminated the risk the high risk of getting infected from the sexual partner.
So that means nikipata maybe niseme I'm positive, alafu yo mwingine ako negative na ameshaamua anataka na mimi forever. Sasa that means atachukua hiyo PrEP kila saa.
In a discordant relationship where one person is HIV positive and the other partner is HIV negative, it is important to employ the two strategies. One, the positive partner will have to be initiated on ARVs so that the virus is suppressed in their body. And when the virus is suppressed, it's not easy to transmit the virus to the negative partner. They cannot transmit the virus to their negative partners. But before we eliminate, or rather we do examination to confirm if the virus is suppressed, during this time we encourage the negative partner to continue using the PrEP as an initiative, or rather a preventive mechanism from getting the virus from their positive partners.
PrEP inachukuliwa on a daily basis, ndio, for 7 days before having sex, ndio. What if you miss a day or 2 days without taking the medicine? What happens?
It is important to understand why do we take the PrEP. And once somebody has the full knowledge as to why they are taking this PrEP, it will be very difficult for them, to miss taking their drug, knowing the consequence, or rather the impact awaiting them should they miss to take the drug. The essence of taking the drug 7 days before an exposure or an occurrence is to ensure that the content of the drug, the level of the drug, is enough in the blood to counter the virus that may spill into your blood. So when you have the drug in your bloodstream for 7 good days before a sexual encounter, then it means by the time you are going to meet sexually, the level of the drug in your blood is enough to counter the virus that is now coming on board. So you will realize that you will first of all understand, why do I really need to take the medication? And if I have known the reason for taking this medication, then what is this that makes me not to take it daily? Yes, it should be taken daily. So at that time, we will be addressing the gap, the adherence challenge, the challenge as to why you are not taking the drug on a daily basis.
And what if you miss 2 or a day? Do you continue with the medicine or?
We encourage a continuation of the same. You will continue using the drug even if you just miss for 1 or 2 reasons. Because all we want is to put a stronger mechanism of ensuring that you are protected from getting HIV transmission. So by the time umeacha, see, it is obvious you may contract the disease hapo mbeleni. So we encourage consistently use it. Na kama ni lazima umemiss for pengine a day, the following day continue taking your medication, because the previous one shall have covered you for that one day. But if the trend continues, then we question your adherence.
What are the side effects of the PrEP?
Mm-hmm. Thank you. PrEP, just like any other medication, has got side effects. And the side effects vary, or rather they range from one person to the other. The common known side effects of PrEP is nausea, fatigue. You may just feel you're tired, your body is a bit weak, but all these side effects are not experienced by all people taking the drug. Some of them are just okay. A few will report those side effects. PrEP has drugs that are also being used by those who are positive, but the purpose is what matters. For those taking ARV, they are on treatment. But for those who are preventing a transmission, we say they are on prophylaxis. They do say it is better to prevent than cure. Prevention is better than cure. So they will be put on this drug, yes, it is part of ARVs, but being used to prevent transmission, to protect somebody from contacting the HIV virus, other than waiting to take the ARVs for the rest of your life. You can take PrEP as long as you are just at risk, and maybe after you have solved the issues and you are no longer at risk, you can stop taking the PrEP. But you see, on the other hand, when you are HIV positive, you will have to take PrEP in your entire life. So it becomes a lifetime thing.
And I've heard you talking about when someone is suppressed, the VL is suppressed.
Mm-hmm.
So what if the VL is up?
Okay.
So kuna gani nini, mtu akimeza hiyo PrEP atameza hiyo for lifetime juu sasa viral load yake iko high. Sasa si kuna hiyo possibility ya kupena HIV.
We started by saying PrEP is used by people who are HIV negative and not positive. HIV negative. When somebody is HIV positive, we initiate on ARVs and they use it. It is a lifetime medication. So even if I am HIV positive today and I decide to use PrEP without using the ARV that is prescribed, I will not be using the desired drug for the infection that I have within me. So it will not help me. So PrEP only helps those who are HIV negative and not HIV positive. For those who are HIV positive, we give them a relevant drug meant for that treatment. But for those who are HIV negative, we give them a PrEP as a measure to protect them from getting HIV virus.
So meaning if I'm positive, I should not take the drug. The other partner is the one who should be taking the drug.
Yeah, when you are positive, you will use the ARVs depending on that prescription. But when your partner who is negative will be on PrEP. So your drugs are never the same. Yeah, I understand. Many of us do not really understand the difference between PrEP and PrEP. As I explained first, that PrEP is a pre-exposure prophylaxis. Something pre means it is a preparation, something you have put in place before an occurrence. It means you are ahead of that occurrence. But when we talk of PrEP, it's a post-exposure. The other one is pre-exposure. This one is a post-exposure. So when you use drugs after an exposure, then we call it an emergency. It is an emergency pill. So you are using it to counter what has happened. That is now PrEP. After an occurrence, a sexual occurrence, you now use PrEP, within 72 hours, because you are rushing, you are trying to mitigate an occurrence, a contraction of HIV virus that has occurred. But when we talk of PrEP, you are putting drug into your blood, into your system before an occurrence. So you already know that there may be an occurrence, but there is a measure you have put in place.
Unatumia PrEP, si ndio?
Mhm.
Na uko under some other medications. Does it affect you?
It is also important to know that whenever somebody wants to use PrEP, there will be a clinical assessment or rather review to unearth or to know the chronic conditions that somebody may be at, so that we analyze all these and advise accordingly. Because there is one other side effect of PrEP, that it can cause some renal conditions, that is a defect in the kidney functionality. So during this time, it is important to also even do what we call the kidney functionality test, so that we ascertain that your kidney is functioning well and has no any complications, so that when you are put on PrEP, it does not worsen your situation. So somebody who has kidney problems may be advised accordingly on the use of PrEP.